Thank you. It's been a while, but we've taken time to hear and input and answer questions for all of our stakeholder groups through the course of the pandemic. And I think we'll continue with that practice beyond the pandemic, but specifically around the health orders, we received lots of phone calls and lots of emails asking about the rules and what the district's going to do. And so wanted to create a couple forums other than just a survey to have a conversation. So this group will have a dialogue and just would open it up to anybody to share and comment, and in a very respectful way to just share your ideas. I will tell you that Karen Minshew, Michelle Hayes, and I just had a meeting with Wilma Wooten and Gary Johnston, who are the officials in San Diego County Public Health. And they clarified that the mask mandate is not optional. Districts do not have discretion on whether or not to require masks. And that's coming from the state of California. So I asked the question, well, what are the consequences? And basically, the consequences would be a lawsuit, a loss of school funding, and that they would shut us down and not be able to offer school, period. So this forum will be recorded and then posted to our website. And also we're having a special board meeting on Wednesday to hear public comments. And those comments we're going to take to the state so that our families and our community has a voice. They don't seem to be interested in listening, but we're going to make that not optional for them. But with that, I would love to hear your feedback, your thoughts. Just say hello.
We have one hand up, David. Chrissy.
Go ahead, Chrissy. Hi, good to see you.
I feel like sometimes I feel like I'm the reason for this, or my community. But you answered one of my questions, which was if you had the discretion already, and who gives that discretion. So who would give you the right to do that? Right now,
it's California Department of Public Health, and they're under the governor's oversight. So it's Gavin Newsom and Mark Galley.
Newsom.
And Dr. Mark Galley is the lead doctor for California Department of Public Health. This is their call.
And so the reason that private schools cannot have masks and we can't is due to we receive state funding. Is that correct?
They clarified that all schools, private, charter, and public, must adhere to the state mandates.
Okay. And then, so I know I'm being like a little technical, so I apologize. Because I know that we've talked about this like a little bit, Naomi and I. So I just want to clarify. So when I talk to my parents, I know exactly what's happening. So walk me through the process of just when discretion is given. So when the California Department of Health, Dr. Mark Galley and Newsom say it's at the discretion of the districts, I want to know what steps will make masks optional. Specifically, do we need teacher and staff unions approval?
Karen, Michelle, you thought with those questions too.
Does that need to be approved? Does our board need to approve it? Do we need site approval, like based on each school? And do we need like your approval, like the superintendent district as a whole?
Yeah, great question. So the current MOU that we have with our labor unions does say that the district will align with California Department of Public Health guidance and requirements. And so as those change, our agreement will stay consistent with that. So if the state loosened up restrictions, then automatically our contract would realign. Michelle, you have some clarity?
Yeah, if there's anything, significant changes, or we're always happy to meet with our associations, both CSEA, CVEA, to discuss the impacts and effects of those. But we have been very closely aligned with any county public health guidelines that have been issued, and I've been working really well with the associations on any of those changes, and I've had lots and lots of conversations, and we'll continue to do so as well.
So the rumor that kind of goes around, that's populated also by the media, that the teachers unions would block mask mandates from being lifted at our district specifically. We don't envision that as an issue. Is that correct?
No, we've worked really well with both CSEA and CVEA on anything that impacts the schools and really all of our employees.
Yeah, I think it's fair to say that just because like we see that it's been lifted at summer school for outdoors, and obviously I don't think if they were going to block masks that would be happening.
Chrissy, would you mind introducing yourself because it's a new group? And then as people speak, we'll just say who we are.
I'm Chrissy McCullough. I'm a parent of kids at Blossom Valley and at LCC, and I'm the PTO president there. And I think as long as nominations go correctly, I'll be the LCC vice president. If not, then somebody else will be here for that too.
Very good.
So for board approval, would we need board approval for the masks? Like when it came time, is that a step that would need to be taken? Like, would they have to vote on that?
Does the board approve our MOUs, Michelle? Do they receive it?
We give them the information, but generally if it's a language thing, then not necessarily.
Okay.
But if there's anything significant, any of them we bring to the board for sure. And we would be aligning with obviously both the board, CSEA, CVEA.
Thank you.
So would sites be different? Like, would site approval be different? Like, would one principal be able to say, we're still maintaining masks for everybody, and another principal saying no?
No, anything like that, like that's a significant impact that would affect all of our employees. So in order to remain consistent and have equity for both all CSEA, CVEA, and district employees, we'd have the same guidance that would govern all of our schools.
And obviously, David, you would be okay with masks being lifted?
We're in the process of listening. So it's important to have data. And of the 16,500 parents that we have, only 400 completed a survey thus far. So it's really a very small subset.
And what is a timeline when if Gavin Newsom lifts this, what is a realistic timeline that we would be able to implement it if everybody was on board?
Well, he's been nothing but inconsistent. So I'll share what he said last. The last statement was that they will revisit these health orders in November.
Okay. And is that why when a staff email went out that it was said that we wouldn't be revisiting it until October? Because that's a rumor that's going around too, that people have been screenshotting, is that there's that our district told the teachers not to worry about anything, that it won't be revisited at least until October. Is that consistent?
I don't recall seeing that. Please forward that to me if you have it.
I don't have it. I'm just basing off of I told parents to text me with their questions, and that was one of them. So there wasn't an email about October, right?
Not from here.
Okay.
Thank you, Chrissy.
And can I ask one more question about the masks? When masks are optional for students, will they also be optional for staff?
Well, I think that a lot of the frustration with our staff is that they've taken the time to get their vaccines and still don't have the option. I've heard that from several employees as well. And there was no question that we have to adhere to the health guidelines from this afternoon.
Okay.
Nick, will you introduce yourself to the group and come in the conversation?
Hello, my name's Nick. I'm a teacher and a representative from Montgomery Middle School. Welcome, everybody. How are you? Thank you for asking all those questions, Chrissy. That was awesome. Big question at my school is the stable groups. Will we still have to have the stable groups? And I believe the next question would be the block schedule, because it seemed like we had a block schedule last year because of stable groups. So what will that be like, please?
So Nick, we're actually in conversations right now with CVEA related to that. After the meeting today, the stable groups were a recommendation, and it is one of the an important part of mitigation strategies. We'll be meeting again with CVEA on Friday, and those are some of the things that we're still trying to work through. But it was, based on the meeting today, a strong recommendation, and it is one of the key points, both for contact tracing, but also for reducing spread.
So will we be keeping block schedule or going back to regular schedule?
We're working through that with CVEA right now.
Thank you.
On that note, Nick, one of the things they clarified with was one of the reasons the state decided to keep the mask mandate in place is because most schools won't be able to have everyone back 100% with the distancing guidelines. So rather than eliminate, so that keep the mask in place so that you can have more children back in a regular classroom. Mark, Dave, why don't you guys introduce yourselves and so we know who you are and how we can access our leadership.
Hello, everybody. I'm Mark Regals. I'm CSEA chapter president.
Hello, I'm Dave Szymanski. I am the Teachers Association, CVEA president.
So basically they oversee all of our employees and provide leadership. Hi, Nina, would you please introduce yourself to the group and come in the conversation?
Hi, my name is Nina England. I am a parent. I have two kiddos, one at WD Hall and one at Rios in Cajon Valley right now. And I had a question because you guys had brought up the stable group situation. When it comes to the stable group situation, and then as we're kind of working around this mask mandate and those issues, we kind of have concerns about the stable group situation and our special education kids because it seems to be creating a barrier on allowing them full access to the general ed students. So that way they kind of meet their fate there with having that access. And so I'm wondering if we have a plan going forward as we work on the stable groups, do we have a plan to meet our special ed kids' needs that doesn't involve Zoom? Because last year, my special ed kiddo was in school in his special day room, but his only access to general education kids was via Zoom in his special day room, and that's not exactly meeting the needs.
David, I can take that question. So thank you, Nina. That's a great question. Last year, because we had to shift everything so quickly and there were so many changes that were going on in the midst of the school year, a lot of students elected to stay in distance learning programs, and therefore we had a lot of staff in distance learning programs. As of right now, that is not the situation in the upcoming school year. So we've aligned staff with on-campus learning first. And so your child should have access to their general education classrooms just as if they would in a typical school year. Even though we have right now, the recommendation is to provide stable grouping. A child's education comes ahead of stable grouping. It's just trying to organize it so it's yes and. So yes, we have stable grouping and kids can be in the program that they need to be in. But really it's program to meet the students' needs first and figuring out how that stable grouping can work for them. There's a lot of people on the call that will share right now that stable grouping isn't perfect. It isn't every single situation in which there isn't a kiddo that might be in a different group at some point in time. But the way that we reduce that and how well we reduce it certainly increases the safety, and it reduces the number of exposure and contact tracing, et cetera, et cetera. So it doesn't have to be 100% perfect, but it is better the more that we do that. And that's the lens that we're looking at it as we're creating those stable, as we have been creating those stable groups. And we'll be working with CVEA and CSEA as we continue to move forward with that recommendation. I hope that answered your question. It's much better.
Thanks, Michelle.
David, we have two questions in the chat.
Karen, you want to unmute yourself and ask your question?
Hi, my name's Karen. I'm a PTA member at Fuerte and for the district. I am just trying to understand what data we're looking for. There's a lot of parental resistance to masks because they don't feel like they're clean enough or the kids are touching them. And I just want to look at both sides. I want to make sure our kids are safe from COVID, but also from the other effects of mask wearing. I don't want to just take off a mask just because we don't like it. Mm-hmm. So I have tried to look for data myself and I'm struggling.
Thank you. We at the district are not really looking at specific data. What the county is reporting is that they're no longer reporting daily case rates. They're reporting only every week. And what they have seen though is that this summer they've had an increase by about 8 or 9% of positive case rates since the Delta variant, this new strand of the virus has been increased. So what counties are looking at are positive case rates, outbreaks, and transmission. And so, for example, LA County has seen a large upswing, and in LA County, mask mandates went in place for all indoor settings again. San Diego said that they don't see that happening here, but they won't rule out anything because the data tells the story.
So we're basing it on positive case rates or on hospitalizations? Is the county going to go to a colored tier system again? Are we going to go off that?
There's no indication that that's going to be the case, but I stop trying to predict the future after the first couple of months of the pandemic.
Okay.
Yeah, thank you. April, you want to unmute and ask?
Yes, hi, my name is April Adler, LCC PTA president, and I'm also on the board at Blossom Valley PTO. We have lots of questions at our school about school hours, if they will be resuming to normal pre-COVID hours, so parents can start planning if they need to send their kids to EDP or adjust their new work schedules, et cetera.
Michelle, Karen?
Yeah, so yes, school hours are going to be resuming to the pre-pandemic school hours. So if you were a 9 o'clock start, you'll be in 9 to 3:30 and 8 o'clock, 8 to 2. And yes, EDP, and we've got some great plans in place. And for that, I'll turn it over to Karen because she might want to add some more information regarding EDP.
I don't really have information to add, but thank you for bringing that up, April. I'll get a central communication out that we're going to pre-COVID hours and list all the school start and end times and links to EDP.
Thank you so much. I think that will be really helpful and alleviate a lot of parents' worries.
Thank you. Hi, Christina.
I might be glitchy coming through on here. Can you let me know if I'm glitching or not?
We can understand.
Okay. I just wanted to introduce myself. Hi, I am Christina Kerman. I was at Montgomery for 2 years. I'm currently at Lexington for SY for the summer, and then in the fall, I'm going to Hamishaw Elementary, work with the littles. Somebody had mentioned worrying about FAPE and LRE. For those who don't know, I'm sure most of us do. FAPE is fair and appropriate education, or fair, appropriate public education. LRE is least restrictive environment for special education. The way it worked at Montgomery was most students, unless they had severe needs, would be in the general education setting for most of their day and would be polled appropriately for support, such as SAI, which is special academic instruction, English language development, or other SPED services like speech. I don't know how it works in elementary, but I feel like that was really doable in a middle school because of the period schedules.
And Michelle, you mentioned that we're going back to a more typical schedule like that for students with individual education plans?
Yes.
Thank you, Christina.
One more question from Whitney in the chat. Whitney, do you want to unmute yourself?
Hi, yeah, sorry. Whitney DiCrescenti, I'm the PTA president at Avocado Elementary. I just had a couple of questions about if campuses would be allowed to have volunteers on campus during school hours. I know last year that was very limited. even if it was just like a basic group of parents, like the approved room parents or PTA board members or general members, PTA members, to assist with either any school needs or setup for things or events that we may or may not be allowed to still have. And then my other second question was if the sick rules will still apply this year. If a child has a cough or runny nose, if they're still going to have to be out for the 10 days or show a negative test.
There were a couple updates to the guidance, Michelle. Do you recall? Can you articulate, or Karen?
I can pull them up here in a second. There is some, I guess, reduced guidelines regarding the volunteers on campus. The recommendation that anybody that is on campus is minimized to only essential and to people who are vaccinated. But I'd have to pull up the exact guidelines to give you any more specific information on that. And those are some of the things that we still are needing to work through. But vaccination is going to be key. And it's not as, I guess, as significant as it used to be.
Based on the question though, Whitney, it sounds like parents would like to have the opportunity to reconvene and start doing some of the service and volunteerism.
Absolutely. I know at Avocado we would. I would like to be. I'm not vaccinated, and I'll admit I don't plan on being vaccinated. So that would be unfortunate if I couldn't be on campus. I'm willing to follow a mask rule, even though I prefer not to wear one. I would, and I wouldn't mind a screening, a health screening. That doesn't bother me. But yeah, if that's something that could be considered, like I said, even if you keep it to a small group so we can be present to help and do things, that would be great. I would appreciate it. So.
Thank you.
Mm-hmm.
Michelle, you're looking that up for us, if there's updated guidance?
Yeah, I'll keep looking for it.
Okay, thank you. If you don't find it, Whitney, we'll make sure that's part of our recap. And Nina said yes.
Can I would like to ask a question about the volunteering as well. Before, in last meetings, we had said that vaccines would be optional. Like, I'm already vaccinated, but I know that we talked about like students and stuff, that would always be a choice. Are you guys still consistent with that? That vaccines for students when they become available will be a choice, or for adults working?
That wouldn't be a district decision, but the state did say that with the current status of emergency use, they don't plan to mandate any vaccines. Pfizer is supposed to have a trial up for FDA full authorization, and that may be something that the state decides to do, but that's not something that we decide locally here.
But volunteers would be mandated to have a vaccine if they're on campus?
I just put it in the chat, Chrissy. What it states is that schools should limit non-essential visitors, volunteers, and activities involving external groups or organizations with people who are not fully vaccinated, particularly in areas where there's a moderate to high COVID-19 community transmission.
So does that mean if they are vaccinated, that it could be like as usual? Is that kind of what we're saying? Yeah, okay. And then can I ask a few more questions, or does somebody else want to talk? I know I talk like the whole time and I feel bad.
Yes, we have a question from Edith. Edith, do you want to unmute yourself?
Hi, everybody. Yes, hi, my name is Edith Hernandez. I'm a parent at Bostonia Global Academy. I'm PTA president too. And I was also wanted to add to are we going to continue temperature checks in the mornings and just regular protocols?
That I don't think has changed. That's part of the school guidance.
And which add me to another question, if I may. If we get any volunteers to perform those temperature checks in the morning, do they need to be vaccinated as well?
Based on what Michelle just put in the chat, it sounds like that's not hard language. I think that consistent with the other practices is mask wearing might not be optional, but I don't think that vaccinations will be mandatory. That's just based on what I'm reading.
Thank you.
We also have a hand up from Karen Rand.
Yes, I didn't hear the answer to Whitney's second question, and I was wondering the same thing because last year, 2 of my kids got quarantined from school for 24 days because of a positive case from a sibling in the household. And so our kids going to be quarantined for lengthy periods of time again this year.
So there is some updates related to quarantining. And we're our health services department. Jeremy, are you on the call? Do you want to respond to this one before I?
He's not. He just
Okay.
actually left my office.
Okay, no worries. So the quarantining period, they are allowing a modified quarantining, and it's pretty detailed, but it's related to whether a student is vaccinated or unvaccinated, whether they're able to maintain some distancing, obviously wearing a mask the entire time, and then being tested 2 times a week during their quarantine period to allow them to remain on campus. And so we're just working our way through those new requirements, and we'll have more information out to everybody as they kind of take shape.
Thank you.
And what that will look like. We'd like kids on campus all the time as much as we possibly can. And obviously with safety in mind too, but we're happy to see that there's at least some changes made to them.
Go ahead, jump in there, Chrissy, and then as hands pop up, we'll bring other people in.
Okay, so I just wanted to clarify, when you guys say that essential and or vaccinated for the volunteers, that's coming from the state of California, right? So when we go back and like deliver this news to parents, that the vaccination requirement is from the state of California and not district.
So
They
the
haven't-
line,
Volunteers.
Go ahead.
Okay, I just wanted to clarify that. And then a couple other questions that parents have sent me was, is sex education changing in the 7th grade? Will there be changes?
No,
It was
no,
previous-
and no, and no. So what's going on out in the cyber world?
And is,
But
will
no.
critical race theory be taught at our district?
No, we
Okay.
have the world of work. We
And,
have a whole different program. Wait, you got to make sure. So I think something's happening out there in the social media world, because we've had lots of calls on those 2 topics, and they're calling and trying to convince me that it's happening. I go, ma'am, I'm the one that looks at curriculum and brings it to the board.
I think
I
that's
promise.
why this is so great, is because I can say yes, and there's a video. You can go look. You said it. And I know I called Naomi about it a couple of days ago. I'm like, no, they never said children are getting vaccinated or, be kicked out of school. But as you guys know, with the media, there's a lot of things, and people tag certain people in there, including people from our district, on certain Twitter things. And I don't want to call them conspiracy theories, because I don't think that's the right word, but there is a lot of, that's why I say, can we clarify this rumor? Like, I don't know what was sent out. So just to make sure, that way I can say, nope, they told me no, that's absolutely not happening. And to kind of piggyback on what the other parents were asking, are there any events or programs that will still not be allowed? I know for Blossom Valley specifically, we really want to see things that made our school special back again. And I know that including the teachers have mentioned interest in it, like music and fall festival and dances and things like that. Are those things going to be allowed, or is like PTO like kind of just not needed? Like what is the role there for parents and community outreach?
I can address one piece of that. There's no perfect answer, Chrissy, to that question. And obviously, as months go on, data will change, guidance may change. Something that came up early was 6th grade orientation. And as you listen to that guidance, that's kind of vital that parents understand, where is my child going? I've never been on this campus. Our principals are very smart. Instead of doing things the way we've always done them, they're doing them in smaller rotations, less contact, fewer groups, multiple days, multiple times, to minimize large groups. So we're just kind of thinking of doing them. Is this essential? That's our first question. And then following the guidance and trying to minimize really large groups as well.
Thanks, Karen.
Any more questions? Now's your time.
David, I think we should keep our talks topics to mask and COVID for this forum.
Yeah.
Do have a question regarding that. A while back, there was that pilot program for the testing that was happening for COVID. Is that something that's going to happen at this school year? At all the different sites? Or was that just like I don't know, practice example to see how it goes?
Last year, that's a great question, Jemima. Thank you. And you're the PTA president?
Yes,
for the
Cajon
council?
Valley Council PTA president. Sorry, guys.
When they first started to reopen schools at scale, one of the requirements were going to be that we had asymptomatic testing. So we put together a pilot because initial announcements were that if we didn't have it in place, we wouldn't receive the funding. So we wouldn't put something together, but that was eliminated from the state as a requirement. So I don't see us doing that at scale. Is that something that you have interest in, or just
No,
curious?
I'm just curious. Just curious.
Yeah.
And then with this whole thing with the mask, so I've been looking at at the news and whatever. There's, I guess, other school districts in San Diego that are saying no to masks. How are they able to get away with it and other schools districts are not? Just curious.
We'll not name them, but they were reprimanded by the county public health officials and were walked back. But
Okay.
we won't name them.
Gotcha. Okay. I was just curious. Thanks.
Can I add to that at all? That if she's referring to Alpine, because I can name them, if you look in the wording, and that's what I was putting on Facebook, like time and time again, it says on there, when we are given discretion. That was the wording they used. And that's why I asked Naomi, I actually called her. I was like, what does that mean? Like, do we have discretion or not? And that's why that was one of my first questions was about discretion. So he worded it same like he did last school year in the fall. He said, we're going back 5 days, and then he didn't. And then this is what's happening again. And I feel like it's kind of a pattern with that district because he puts that out there, and that affects my community specifically because we all live so close by. Like, those are our neighbors. And so then he puts that out there, and then it's like kind of like a whirlwind of like things happening in our like East County communities. And he put in, it's very tricky, the wording, because he says, when we're giving discretion, but he doesn't say that there won't be masks next year. He just says when they're given discretion, but there is no timeline for that. And there was no like approval specifically. I don't know if that's the school she's referring to. That's one I know of, but that's the screenshot going around for sure.
Okay, we have Lisa is next. Do you want to introduce yourself, Lisa? Unmute yourself.
Or Lisa Tolman. I'm a teacher at Madison. It's good to hear all these parent voices. We don't get to hear those very often. I just wanted to second a comment that Jemima made in the chat about the survey. I also found it very obtuse. I found it very unclear what I was really supposed to do. So I personally have not filled it out. So perhaps a revisit of what you're asking people to do might get you a few more responses. Just my 2 cents.
Thank you, Lisa. I've heard that a couple of times, and what we want to do is to provide the voices of our parent and staff to the governor and State Department. So it's a mechanism to do that in a cohesive way with an audio and also written. But I can restate that if that would help, you think.
I guess I just didn't am I supposed to say my personal feeling, I'm vaccinated, I would prefer to go back without a mask? Is that what I'm?
When I wrote the email, it sounded like we had some discretion. That's been clarified today, that there's zero discretion.
Okay.
We wanted to find out from our people, where people were feeling and thinking, which is helpful anyways, but and the data we're going to publish everything publicly.
Okay, thank you.
Thank you. Christina?
Okay, hopefully it sounds better this time. So I'm curious about the quarantine rules for staff. What is the rules for staff who are exposed and are vaccinated? Those who have not been vaccinated, and if they've already had COVID and have the antibodies, what's the 411 there?
So the current quarantining, if you are vaccinated, you do not need to quarantine. If you're unvaccinated, then likely those same guidelines would apply to staff as well. That you could do a modified, you have to be tested twice a week, but vaccinated staff are able to remain on campus.
Okay, and another part, do we know if FFCRA, the Federal Family COVID Relief Act, will that be reinstated this school year, or are we not doing that?
We have not received an update on that. Our current leave that we have available is available through September 30th, I believe, Christina. I'd have to confirm that, but I'm pretty positive it's September 30th. And we do not have any newer updates than that.
Okay, and for staff members who are medically unable to get vaccinated, when you guys do get discretion to say we're not going to mandate masks or we are going to keep mandating, when there is that discretion, like I'm personally allergic to one of the stabilizers and I wish I could get it, but anaphylaxis is not something I'd look forward to. So what can I do for people who are not medically able to get the vaccine?
Anybody is more than welcome under any situation to continue wearing a mask. And for people that are not vaccinated, I would imagine that's going to continue to be a recommendation, even though at some point in time there may be the requirement lifted. But in every communication, it's been continued a recommendation for those people who are unvaccinated.
Yeah, once we reach what they call herd immunity, which is, I think it's 75%, might be, is it, do you guys know for sure, Michelle?
That sounds familiar to me too, David, but I don't know for positive.
Then that's when the health department. I'm sorry?
Everything I've heard on the news and communications from you guys has said 75% vaccination is herd immunity.
Yeah, so total population, meaning young kids that don't have access to vaccines yet. So once we reach them, then all the different orders will go away. So it's not if, but when.
We have a question from Whitney in the chat. Whitney? You're muted, Whitney.
Oh my goodness. I'm so sorry. My computer was going back and forth with the buttons. Does the district or even maybe the state consider people who tested positive for COVID to be vaccinated? Or does that still require even those folks to be vaccinated?
That's a great question. And we asked the CDC that in Washington last week, and they said that they're still doing research, but the CDC does not acknowledge that yet. And California will follow CDC.
Okay.
Brandon, looks like you really want to ask a question.
I'm just hanging out here if you need me.
Steve, you want to jump in?
Nah, I'm just like Brandon, just hanging out listening, guys.
Well, thank you so much, everybody, for spending time and for being on a group call. And I think that once we resume regular school, we'll start having somewhat regular meetings again. But your input's so valuable, and you just appreciate that you took the time.
Thank you so much, everybody.
And feel free to reach out by email. Happy to make an appointment or have individual conversations for those that would like a more private conversation. Okay.
Bye. Thank you, everyone.
Great afternoon. Thank you.
Bye, everybody.
Thank you, David. Bye, guys.